Welcome to a deep dive into sperm health.
Ooh.
We're going way beyond the birds and the bees today.
Yeah.
We're diving deep into the fascinating world of sperm anomalies and
Okay.
exploring some holistic approaches to, improving things.
It's an area that doesn't get enough attention,
Yeah,
but it is absolutely crucial for couples trying to conceive.
absolutely.
Yeah.
We've got some great research and insights from the Berkeley Center for Reproductive Wellness to help us unpack all of this.
They are.
They are experts in the field.
They are indeed.
Yeah.
They've been leading the way for decades now.
Okay, so let's jump right in.
Yeah.
What exactly are sperm anomalies?
Okay.
I know people toss around the term low sperm count,
Mm-hmm.
but it feels like there's a lot more to the story.
You're absolutely right. It's a whole spectrum of things.
Yeah.
Think of it like this.
Okay.
Sperm have a pretty tough job.
Okay.
They have to swim a long distance, navigate obstacles, and ultimately deliver their precious cargo.
It's a tough job.
Any kind of glitch in their structure, their movement,
Yeah.
or even their DNA can
wow.
throw a wrench in the whole process.
Okay, so it's not just about quantity, it's about quality too.
Yeah.
But what kind of glitches are we talking about?
Mm-hmm.
Paint me a picture.
Well, imagine a sperm with two heads.
Really,
Two heads?
it happens.
Wow.
And it's a great example of how shape matters.
Right.
A two-headed sperm might have trouble swimming in a straight line.
Right.
And even if it reaches the egg, it might not be able to fertilize it properly.
Wow. That's wild.
Mm-hmm.
Okay, so weird shapes are one thing.
Yeah.
What else can go wrong?
Sometimes it's a matter of movement or lack thereof.
Okay.
If sperm are sluggish swimmers or just not moving at all, they're
Right.
not going to get very far.
Makes sense.
Yeah.
And I've heard the term DNA fragmentation thrown around a lot.
Right.
What's the deal with that?
That's where things get really interesting.
Okay. We're not just talking about the sperm's physical form anymore,
Yeah.
but the integrity of its genetic material.
Right.
If the DNA inside the sperm is damaged,
Okay.
it can lead to all sorts of issues.
Like what?
Well, for starters,
Okay.
it can make it harder for the sperm to fertilize an egg in the first place.
Okay.
And even if fertilization does occur,
Uh-huh.
the embryo might not develop properly,
Got it.
which can lead to miscarriage or other complications.
So it's not just about getting pregnant, it's about having a healthy pregnancy.
Exactly.
Yeah.
Sperm DNA fragmentation is a crucial piece of the puzzle that often gets overlooked.
Okay, so fragmented DNA.
Yeah.
That sounds serious.
Yeah.
But what causes that to happen in the first place?
It's a combination of factors.
Okay.
Sometimes it's age, sometimes it's genetics,
Okay.
but lifestyle and environmental factors play a role too.
Yeah.
Things like smoking, excessive alcohol consumption,
Right?
exposure to toxins. These can all take a toll on sperm DNA.
So it's like those bad habits that we know are bad for us in general.
Exactly.
Mm.
Are also wreaking havoc on a microscopic level.
Right.
Yeah.
Okay, so let's shift gears and talk about what we can do to improve things.
Yeah.
This is where the Berkeley Center comes in, right? They have this whole holistic approach to sperm health.
They do.
Yeah.
And that's what's so fascinating about their work.
Mm-hmm.
They don't just treat the symptoms. They look for the root cause
Right.
and address it from multiple angles.
Okay, but what does that actually look like in practice?
Mhm.
I'm picturing lots of green smoothies and meditation retreats.
Well, it's more than just that.
Okay.
They use a combination of Eastern and Western medicine.
Okay.
For example, they use acupuncture,
Right.
which has been shown to improve sperm motility morphology and even reduce DNA fragmentation.
Acupuncture for sperm health.
Yeah.
That's not something you hear every day.
It's pretty amazing, actually.
Yeah, how does that even work?
By stimulating specific points on the body,
Mm-hmm.
acupuncture can improve blood flow to the reproductive organs,
Okay.
balance hormone levels, and reduce oxidative stress.
Interesting.
Yeah.
So it's not just about needles.
Mhm.
It's about triggering the body's natural healing mechanisms.
Exactly.
All right.
And they don't stop there.
Yeah.
They also use customized herbal formulas
Okay.
that are tailored to each individual's specific needs.
So no one-size-fits-all approach here.
Not at all.
Okay.
These herbal blends can address a wide range of issues,
Mhm.
from nutrient deficiencies to hormonal imbalances to inflammation.
Oh.
It's all about identifying the underlying cause
Right.
and creating a targeted solution.
It's like giving your body the specific tools it needs to create healthy sperm, right?
Precisely.
Yeah.
And the best part is that these herbal remedies work in harmony with any other treatments the patient might be undergoing,
Okay.
whether it's Western medicine or lifestyle changes.
So it's a truly integrative approach. I'm starting to see the appeal of this holistic approach.
Yeah.
It's not just about treating the symptoms.
Right.
It's about addressing the whole person.
You've got it.
Okay.
And that's what makes the Berkeley Center so successful. They're not just treating sperm, they're treating people.
This is all so fascinating.
Yeah.
Okay, so we've covered acupuncture and herbal medicine. What else is in their holistic toolkit?
Well, nutritional therapy is another key component of their approach.
Hold on, before we dive into nutrition,
Okay.
I want to rewind for a second.
Okay.
We talk about acupuncture improving sperm motility,
Yeah.
morphology, and even DNA fragmentation. Can you break those down for me a bit more?
Sure.
You mentioned motility.
Right. Motility is all about how well sperm can swim.
Okay.
Think of it like this.
Yeah.
A healthy sperm should be able to swim in a straight line and with purpose.
Got it.
If they're sluggish or swimming in circles,
Okay.
they're not going to reach their destination.
And what about morphology? You mentioned that too.
Morphology refers to the shape of the sperm.
Okay.
Remember our two-headed friend?
Right.
Ideally, sperm should have a smooth oval head and a single strong tail.
Got it.
Any abnormalities in shape
Okay.
can hinder their ability to swim efficiently
Right.
or penetrate the egg.
Okay, that makes sense. So you got the swimmers, you got the shape, and then you got the DNA integrity.
Exactly.
Okay, now I'm ready for nutrition.
Okay.
What role does that play in all of this?
It's absolutely crucial.
Okay.
What you eat
Yeah.
can have a direct impact on sperm health. Think of it like this.
Okay.
Your body needs the right building blocks to create healthy sperm.
Okay, so it's like you are what you eat.
Right.
But in this case, it's your sperm are what you eat.
Exactly.
Got it.
A diet rich in fruits, vegetables, and whole grains provides antioxidants, vitamins, and minerals
Okay.
that are essential for sperm production.
Okay, so the usual suspects for a healthy lifestyle.
Right.
But are there any superstar foods that deserve a special shout out when it comes to sperm health?
Foods high in zinc like oysters.
Ooh.
Beef and pumpkin seeds are great for sperm health.
Okay.
They've been linked to improved sperm count motility and even morphology.
So you're telling me I should swap my morning coffee for a plate of oysters?
Well,
My taste buds might need some convincing on that one.
moderation is key.
Okay.
But incorporating zinc-rich foods into your diet can definitely make a difference.
Duly noted. And on the flip side, are there any foods that men should try to avoid if they're trying to boost their sperm health?
Processed meats, sugary drinks, and excessive caffeine are all known to have a negative impact on sperm quality.
So basically the same foods that we're often told to limit for overall health
Exactly.
are also culprits when it comes to sperm health.
It's all connected.
Yeah.
You can't expect to have healthy sperm if you're not taking care of your overall health.
Right, okay, so we've covered diet, we've covered acupuncture and herbal medicine.
Yeah.
Is there anything else that the Berkeley Center uses in their holistic approach?
They also utilize low-level light therapy,
Okay.
also known as photobiomodulation.
Okay, that sounds pretty high-tech.
Yeah.
What's the deal with that?
It's actually a very non-invasive treatment
Okay.
that involves exposing cells to specific wavelengths of red or near-infrared light.
And how does that impact sperm health?
Well, research suggests that low-level light therapy can stimulate cellular activity, improve blood flow, and reduce inflammation,
Okay.
all of which can be beneficial for sperm production and function.
So it's kind of like giving your sperm a little boost of energy.
That's a good way to put it.
Okay.
And what's really interesting is that it can also help to reduce oxidative stress, which, as we discussed earlier, is a major contributor to sperm DNA fragmentation.
Right, those pesky free radicals.
Yeah.
So it sounds like low-level light therapy can address multiple aspects of sperm health simultaneously.
Exactly.
Okay.
And it's often used in conjunction with other therapies like acupuncture and herbal medicine for a synergistic effect.
So it's all about finding the right combination of treatments that work together.
Precisely.
Okay.
Now, another key aspect of the Berkeley Center's approach is their emphasis on personalized care.
You know, I was going to ask about that. It sounds like sperm health is such a multifaceted issue
Right.
with so many potential factors at play.
Yeah.
How do they even begin to personalize treatment?
They start with a really thorough diagnosis.
Okay.
In addition to the standard semen analysis, which looks at sperm count motility and morphology, They might also do hormonal testing, genetic testing,
Wow.
and even sperm DNA fragmentation testing.
So they're really getting a complete picture of what's going on.
Exactly.
Right.
They're not just looking at the sperm in isolation. They're looking at the whole person. They want to understand the individual's lifestyle, their medical history, their environmental exposures, all of the factors that could be contributing to their sperm health challenges.
That makes a lot of sense.
Yeah.
So once they have all that information, how do they develop a personalized treatment plan?
It's a collaborative process.
Okay.
They work closely with the patient to develop a plan that takes into account their individual needs and goals.
So it's not just about throwing every treatment at the problem and hoping something sticks.
Not at all.
Okay.
They might combine different therapies, adjust dosages, and make recommendations for lifestyle changes, all with the goal of optimizing the patient's chances of success.
Like a customized roadmap to better sperm health.
Exactly. And they might combine different therapies, adjust dosages, and make recommendations for lifestyle changes, all with the goal of optimizing the patient's chances of success.
This all sounds very comprehensive.
Yeah.
But I imagine it also requires a lot of commitment from the patient, right?
You're right.
Yeah.
Holistic treatments often require a more active role from the patient than conventional medical treatments.
So it's not just about popping a pill and calling it a day.
Not necessarily.
Yeah.
It might involve making dietary changes, taking supplements,
Mm-hmm.
attending regular acupuncture sessions,
Right.
and really paying attention to their overall health and well-being.
So it's a more holistic approach in every sense of the word. But I'm guessing the payoff can be worth it.
Absolutely.
Yeah.
Many couples who have struggled with infertility
Mm-hmm.
have found success through these types of treatments.
Okay.
And even for those who ultimately need assisted reproductive technologies like IVF, these holistic approaches can help to improve their chances of success.
That's really encouraging to hear.
Yeah.
It's amazing to think that there are so many options available today for addressing sperm health issues.
It's a far cry from the days when male infertility was often seen as an untreatable problem.
Right. And it sounds like the Berkeley Center is really at the forefront of this field, pushing the boundaries of what's possible.
They're constantly researching and refining their approaches,
Okay.
always looking for new ways to help people achieve their fertility goals.
You mentioned that they've been doing this for over 27 years.
Yes.
Have their methods evolved much over that time?
Oh, absolutely.
What new discoveries have shaped their approach?
27 years ago, the field of sperm health was very different.
Okay.
For example, sperm DNA fragmentation testing wasn't even widely available back then.
Interesting.
And our understanding of the impact of lifestyle and environmental factors on sperm health has grown exponentially.
So they've had to adapt and evolve their methods to keep up with the latest research.
Exactly. They're constantly learning and growing, which is one of the things that makes them so respected in the field.
That's impressive. Okay, so let's say someone's listening to this and they're concerned about their own sperm health or their partner's sperm health.
Okay.
What would you recommend they do?
The first step is to talk to a healthcare professional. They can help determine if further investigation is needed and refer you to a specialist if necessary.
And would you recommend specifically seeking out a holistic fertility clinic like the Berkeley Center?
It certainly wouldn't hurt, especially if you're interested in exploring a more natural and comprehensive approach to fertility treatment.
Okay, great advice. Now, I'm curious, from your perspective, what's the most fascinating thing about this whole field of sperm health and holistic treatment?
What I find truly fascinating is the interconnectedness of it all.
Okay.
We're learning more and more about how seemingly unrelated factors like diet stress levels and environmental exposures can all have a profound impact on sperm health.
It's like a delicate ecosystem, right?
Exactly. And it highlights the importance of taking a holistic approach, looking at the whole person, not just their reproductive system in isolation.
And that's what the Berkeley Center is all about, right?
Precisely. They're not just treating symptoms. They're addressing the root causes of infertility and helping people achieve optimal health and well-being on all levels.
And that, in turn, can lead to healthier sperm and ultimately healthier babies.
It's all connected.
You know, I've always wondered about the impact of diet on sperm health. My friend swears by zinc supplements and claims it made a huge difference for him.
There's definitely a growing body of research
Right.
supporting the benefits of zinc for sperm health.
I've got to tell him we talked about this on the show.
Oh, yeah.
He'll be so smug.
Uh-huh.
Okay, so we've covered a lot of ground here, but we haven't really discussed the role of prevention.
Right.
What can men do to proactively protect their sperm health and maybe even avoid these issues down the road?
That's a great question, and one that we can delve into further in part 2.
Okay.
There are so many things men can do
Right.
to take control of their sperm health and optimize their fertility.
All right, cliffhanger. Well, you'll just have to tune into part 2 to learn more about those preventative measures. Stay tuned.
So we've explored the ins and outs of sperm anomalies and gotten a glimpse into the holistic approach of the Berkeley Center.
Yeah.
Now let's shift gears and talk about prevention.
Yes. Let's empower our listeners with some actionable steps
Okay.
we can take to protect their sperm health.
All right.
Where do we even begin?
Well, a good place to start is with the usual suspects,
Right.
smoking, alcohol, and weight.
Okay, so the classic vices.
Yeah.
Are we talking complete abstinence here?
When it comes to smoking, absolutely. Quitting is one of the single best things men can do for their sperm health
Right.
and their overall health, for that matter.
I imagine kicking the habit is easier said than done for a lot of people.
It is.
What about alcohol? Do we need to go completely dry?
Moderation is key here.
Okay.
A glass of wine with dinner now and then isn't going to sabotage your sperm.
Right.
But excessive alcohol consumption has been linked to
Okay.
decreased sperm count and motility,
Okay.
so keep it in check.
Got it. Cigarettes out, wine in moderation. What about weight?
Maintaining a healthy weight is crucial for hormone balance, which directly impacts sperm production.
Okay.
Being overweight or underweight
Yeah.
can throw things out of whack.
Okay, so aiming for that sweet spot in the middle. What about exercise is more always better?
You know, this is one where people often have misconceptions.
Okay.
Regular physical activity is great for overall health
Right.
and can boost sperm production, but excessive or overly strenuous exercise can actually have the opposite effect.
Really, too much exercise can be bad for your sperm.
It seems counterintuitive, but it's true.
Huh.
Intense workouts can increase oxidative stress and inflammation in the body,
Okay.
which can damage sperm.
Got it.
So find a balance and listen to your body.
Okay, so it's about finding that sweet spot with exercise, just like with alcohol and weight.
Exactly.
It's all about balance. Now I have to ask about diet.
Okay.
What should we be eating to boost our sperm health?
This is where things get really interesting.
Okay.
There are so many foods that can make a difference. A diet rich in fruits, vegetables, and whole grains is a great foundation.
Okay, so the usual suspects for a healthy lifestyle.
Right.
Any superstar foods that deserve a special shout out when it comes to sperm health.
Foods rich in antioxidants like berries, leafy greens, and nuts are fantastic for protecting sperm from damage. And as we touched on earlier, zinc is a crucial mineral for sperm production.
Right.
So load up on oysters, beef beans, and pumpkin seeds.
All right, so we got our antioxidants and our zinc. What about foods to avoid?
Processed foods, sugary drinks, and excessive caffeine are all detrimental to sperm health.
Okay.
They can increase inflammation, disrupt hormone balance, and even damage DNA.
It's fascinating how those same things that are bad for our hearts and our waistlines are also bad for our sperm.
Exactly. It's all connected.
Right.
What's good for your overall health is generally good for your sperm health as well.
Makes sense. You know, we talked about stress earlier, and I'm curious how that plays into the prevention piece.
Stress is a huge factor when it comes to sperm health. When you're chronically stressed,
Right.
your body releases a hormone called cortisol,
Okay.
which can interfere with sperm production.
So it's not just about eating right and exercising. It's about managing our mental health, too.
Absolutely.
Okay.
Finding healthy ways to manage stress, whether it's through mindfulness practices, spending time in nature, or connecting with loved ones, is crucial for keeping those cortisol levels in check.
So meditation retreats might not be such a bad idea after all.
They could definitely be beneficial.
Okay.
And let's not forget about environmental exposures.
Ooh, yes, that's a big one. What kind of environmental factors should we be aware of?
Exposure to pesticides, heavy metals, and even excessive heat
Okay.
can all damage sperm.
So those long, hot baths might not be the best idea if you're trying to conceive.
Probably not. And be mindful of things like plastics, especially those containing BPA,
Right.
which has been linked to hormonal disruptions and sperm problems.
Got it. So swap out the plastic containers for glass whenever possible.
Exactly.
What about those tighty whities? I've heard they can be a culprit too.
There's some truth to that.
Okay.
Wearing tight underwear can increase scrotal temperature, which can negatively impact sperm production.
Right.
So opt for looser fitting boxers whenever possible,
Okay.
especially in warmer weather.
Interesting. It seems like there's a lot to be mindful of when it comes to protecting our sperm health.
It can feel overwhelming at first,
Right.
but I think the most important thing is to be aware of the factors that can impact sperm health.
Right.
And make informed choices whenever possible.
And you don't have to make all these changes overnight. Even small, gradual changes can make a big difference over time.
Absolutely. Every little bit counts.
Right.
And remember, it's never too late to start taking care of your sperm health.
This has been so enlightening.
Good.
We've learned about those fascinating sperm anomalies, the holistic approach of the Berkeley Center, and now we're armed with all these preventative measures.
And we've only just scratched the surface.
Right before we wrap things up, is there anything else you think our listeners should know about sperm health or male fertility?
I think it's important to remember that male fertility is just as important as female fertility when couples are trying to conceive.
That's a great point.
Yeah.
It's often assumed that the burden of fertility rests solely on the woman.
Right.
But that's simply not true.
Exactly. And the good news is there are so many things men can do to optimize their fertility. It's all about being proactive and taking care of yourself.
And if you're struggling with fertility issues, you're not alone.
Right.
There are resources available, and there is hope.
Absolutely. Don't hesitate to reach out for help.
So we've covered a lot of ground today. But before we dive into part 3, I want to highlight one thing that really stood out to me from our research on the Berkeley Center. We've talked a lot about the physical aspects of treatment.
Right.
But they also place a strong emphasis on the emotional side of things.
That's right.
Okay.
They recognize that infertility can be an incredibly stressful and isolating experience for couples.
You mentioned that they have a team of therapists and counselors on staff.
They do.
What role do they play in the treatment process?
They provide emotional support and guidance to help patients navigate the challenges of infertility.
Okay.
They help them cope with the stress, the anxiety, and the emotional roller coaster that often comes with this journey.
It sounds like they're taking a truly holistic approach, addressing not just the physical body, but the emotional and mental well-being of their patients as well.
Exactly. They understand that true healing involves addressing the whole person.
Well, this has been an incredible deep dive so far.
Yeah.
We've learned so much about the complexities of sperm health, the factors that can affect it, and the power of holistic treatments.
It's been a pleasure exploring this topic with you.
But before we wrap up,
Okay.
I want to touch on one more thing that really stood out to me in our research. We talked about the importance of personalized care.
Right.
But the Berkeley Center also emphasizes the emotional aspect of infertility.
That's right.
Okay.
They recognize that infertility can be an incredibly stressful and isolating experience for couples.
And they don't just focus on the physical aspects of treatment. They also provide emotional support and guidance.
Exactly. They have a team of therapists and counselors who are trained to help people navigate the emotional challenges of infertility.
So it's a truly holistic approach in every sense of the word.
Absolutely. They're treating the whole person, not just their reproductive system.
And I think that's what makes their approach so effective. It's not just about achieving a pregnancy.
Right.
It's about supporting people on their journey to parenthood, whatever that may look like.
Couldn't have said it better myself.
Okay, so we've covered a lot of ground today, but I feel like we've just scratched the surface.
There's always more to learn.
Exactly. But for now, I think it's time to wrap up this part of our deep dive. Stay tuned for part 3, where we'll delve even deeper into the specific treatments offered by the Berkeley Center.
Welcome back to our deep dive.
We've covered so much ground already.
We have.
From those intriguing sperm anomalies to the preventive measures men can take.
Right.
And now it's time to delve even deeper into the specific treatments offered at the Berkeley Center.
Yes.
I'm particularly curious about how they tailor those treatments to each individual.
Yeah.
They seem to really emphasize personalized care.
They do, and that's one of the things that sets them apart.
Okay.
They don't believe in a one-size-fits-all approach.
Right.
They recognize that every individual is unique and that the underlying causes of sperm anomalies can vary widely.
So they're not just throwing a bunch of treatments at the wall and seeing what sticks.
Not at all.
Okay.
They take a very methodical approach, starting with a comprehensive evaluation to determine the root cause of the issue.
You mentioned earlier that they use a variety of diagnostic tools. beyond the standard semen analysis.
Yeah.
Can you elaborate on that a bit?
Sure, they might do hormonal testing to check for imbalances,
Okay.
genetic testing to look for underlying conditions, and even sperm DNA fragmentation testing to assess the integrity of the genetic material.
So they're really looking at the big picture, not just the sperm themselves.
Exactly. They want to understand the whole person, their lifestyle, their medical history, their environmental exposures, all of the factors that could be contributing to their sperm health challenges.
And once they've gathered all that information, how do they go about creating a personalized treatment plan?
They sit down with the patient and discuss their goals and concerns. They explain the different treatment options available and work together to develop a plan that feels right for them.
It sounds like a very collaborative process.
It is. They believe that the patient should be an active participant in their own healing journey.
That makes a lot of sense.
Yeah.
Now let's talk about some of the specific treatment modalities they offer.
Okay.
We touched on acupuncture and herbal medicine earlier. Can you give us a bit more detail on those?
Of course, with acupuncture, they use very fine needles inserted into specific points on the body to stimulate energy flow and promote healing.
I know acupuncture is often used for pain relief, but how does it apply to sperm health?
It can help to improve blood flow to the reproductive organs, regulate hormone levels, and reduce stress. All of which can benefit sperm production and function.
It's amazing to think that something as simple as needles can have such a profound impact.
It is, and herbal medicine is another powerful tool in their arsenal. They use customized formulas tailored to each individual's needs, drawing on a vast knowledge of plant-based remedies.
You mentioned earlier that these formulas can address a wide range of issues.
Yes.
Can you give us some examples?
Sure. They might use herbs to improve sperm count, enhance motility, reduce DNA fragmentation, or address hormonal imbalances. The possibilities are really quite vast.
So it's like they're giving the body the specific ingredients it needs to heal itself.
Exactly. And they're always staying up to date on the latest research to ensure that their formulas are as effective as possible.
Now, we've talked about acupuncture, herbal medicine, nutrition. What other tools do they have in their holistic toolkit?
They also use low-level light therapy, which we mentioned earlier. It's a non-invasive treatment that involves exposing cells to specific wavelengths of light to stimulate healing and reduce inflammation.
You mentioned that it can be beneficial for sperm production.
Yes.
Are there other applications for this therapy?
Oh, absolutely. It's actually been used for a wide range of conditions, from wound healing to pain management to skin rejuvenation.
Wow.
It's a very versatile therapy.
Very cool. So they're really pulling from all these different modalities to create a truly comprehensive approach.
They are, and they're always looking for new and innovative ways to improve their treatments.
This all sounds very impressive, but I'm curious, what kind of results have they seen with their approach?
They've had a lot of success in helping couples conceive, even those who have struggled with infertility for years.
Do they track their success rates?
They do, and they're very transparent about their outcomes. They actually publish their success rates on their website, which is something you don't see very often in the fertility world.
That's great. Transparency is so important, especially when you're dealing with something as sensitive as infertility.
Absolutely. It helps patients make informed decisions about their care.
Okay, so we've covered the diagnostic process, the personalized treatment plans, and the specific modalities they use. Is there anything else you think our listeners should know about the Berkeley Center or their approach?
I think it's important to emphasize that they're not just focused on achieving a pregnancy. They're also committed to supporting patients on their journey, whatever that may look like.
That's really heartwarming to hear. It can be such an emotional roller coaster for couples going through infertility.
It can, and they understand that they have a team of therapists and counselors on staff to provide emotional support and guidance throughout the process.
So they're really treating the whole person, not just their reproductive system.
Exactly, and that's what makes their approach so unique and effective.
Well, this has been an incredibly insightful deep dive. We've learned so much about the complexities of sperm health, the importance of preventative measures, and the power of holistic treatments.
It's been a pleasure exploring this topic with you.
And I think the most important takeaway for our listeners is that there is hope, even for those who have been struggling with infertility.
There are resources available, and you don't have to go through this alone.
Absolutely. And I think the Berkeley Center is a shining example of that. They're providing compassionate, evidence-based care. that's helping countless couples achieve their dreams of parenthood.
That's a beautiful sentiment to end on. Thanks for joining us on this journey of discovery. Until next time, be well.